Hello and good evening, everyone. Welcome to another SBAC live stream. This seems to be something that we're doing quite often now, and we're very, very happy to have you with us. My name is Dr. Chitachi Egwu. I am the moderator for this important conversation that we're having today, and I'm also a member of the South Broward Alumnae chapter of Delta Sigma Theta Sorority Incorporated, who is one of the entities putting on this program today. So in addition to the SBAC chapter of Delta, this is also a program put on by the wonderful women at the Department of Health, the Florida Department of Health, Broward County. So we're so happy to have them today. And we are also happy to be supported by the UNA USA Broward County chapter. And UNA stands for the United Nations Association. So thank you to Dr. Eileen Davis Jerome, who is the president of the Broward chapter. And also thank you to the chair of the International Awareness and Involvement, which is a committee of SBAC that is putting this on tonight, Bridget Bain. So thank you to everyone involved. Once again, my name is Dr. Chitachi Egwu. I will be your moderator for this evening. Welcome to everybody. Now we're simulcasting because we are great like that. We are on Facebook Live, so you can tell your friends if you want to share this out on Facebook Live to the South Broward Alumni chapter of Delta Sigma Theta page. We're also on YouTube. So all you have to do is go to the South Broward Alumni chapter, and they don't even have to have a Facebook account. They can watch it straight from YouTube. And we will be taking questions on both platforms. So if at any time you have a question on either YouTube or Facebook Live, go ahead and put it in the chat. And periodically we will get to questions in the room. So with that, I don't want to take any more time because we have a lot to talk about today, and it's going to be a fantastic conversation. Ladies from the Florida Department of Health, Broward County, welcome, welcome, welcome. I am going to allow you to introduce yourselves, and then Crystal will give a brief introduction. Ladies.
Good evening, everyone. I'm Crystal Mobley, the Minority AIDS Coordinator.
I am Sonia McQueen, the Test and Treat Program Manager.
My name is Cremita Russell, and I'm a health service representative with the PrEP Department.
Good evening, everyone. My name is Momac Thurston. I'm the Monitoring Evaluation Coordinator here at the Florida Department of Health in Broward County.
Good evening. My name is Shalisa Hackley. I am a health educator consultant here at the Department of Health of Broward County.
Wonderful, wonderful. Thank you, ladies, again so much for being here. And so, as you all know, ladies and gentlemen, we have an order of things that we have today. And I'm going to ask Crystal Kirkland Mobley if she could give a World AIDS Day overview, please.
Yes, definitely. Since 1988, each year, World AIDS Day is observed on December 1st, providing an opportunity for people worldwide to unite in the fight against HIV, show their support for people living with HIV, and to commemorate people who have died. Collaborative activities such as this live broadcast increases community awareness and action on preventative health services, mainly those provided through health promotion programs and services needed to fight the HIV/AIDS epidemic, particularly in minority and underserved communities. In observance of this day, we wear red ribbons as the global symbol for solidarity with HIV-positive people and those living with AIDS, and is dedicated to raising awareness of the AIDS pandemic caused by the spread of HIV infection. The 2018 federal theme is Saving Lives Through Leadership and Partnerships. Discussions such as this one that we're gonna have tonight is so crucial for our community. The greatest challenge faced in HIV is without a doubt stigma. Sadly, our community has a perception that HIV only affects certain groups or certain populations, and this is not true. Stigma can keep someone from seeking treatment, getting tested. So we all can either be infected or affected by HIV. So it's so great to have a program such as this to discuss this.
Fantastic. And as I was remiss in actually introducing what this is, but Crystal did such a great job of doing this. We're actually discussing the state of HIV and AIDS in Broward County and beyond, particularly for women and women of color, even more particular. So just wanted to clarify that in case everybody was like, exactly what are you talking about? So this is what we're talking about. And this is because World AIDS Day is December 1st. So in just 2 short days, we're going to be marking World AIDS Day. So I've been wondering, Crystal, or anybody can answer this, how do they determine what the theme is for each year?
So the federal theme is set by the federal agency, which is Center for Disease Control. So our HIV.gov website will send out information and resources and posters that we can use nationally in regards to the theme. So this year's theme and all the themes to come will be set by the federal government.
Fantastic. And in terms of that, what specifically are there things that are triggers per se that they look for in terms of this is what the theme needs to be this year because this is something that we've noticed that has changed about the state of HIV?
Yeah, sometimes it's the themes are set around the movement around HIV and AIDS nationally, different things that are going, things that they seek, that they see will increase partnerships or increase testing or treatment around that particular awareness day. So all of the national HIV awareness days, the themes are set federal by the federal government, and the themes are based on the movement of HIV and AIDS at that time.
Thank you. Thank you very much. So let's move a little bit more into the statistics for the US and for Broward County in terms of HIV and AIDS. If Simone McPherson could please come to the stage, you're already there, but if you could cover that for us, we would really appreciate it.
Yes, I will be happy to do so. So I just wanted to start out by saying the importance of HIV surveillance information. Not only helps us to identify trends that is going on within the state and the United States, but also helps us to identify how we can plan our efforts and our services and our efforts and our prevention activities as well. The information that I'm going to be presenting today, the resources that I did retrieve this information from, it's public information, starting with the Florida Health Charts. That website is flhealthcharts.com. It gives you information on the state of Florida HIV case rates, as well as within the 67 counties in Florida as well. And you're able to see the age groups, the race, ethnicities, modes of transmissions. You can play with that and be able to retrieve that information, as well as another great resource is what Crystal mentioned earlier from our federal agency, which is the CDC, Centers for Disease Control and Prevention, and that is cdc.gov/HIV. They have surveillance report and have the latest information on the 2017 HIV case rates and diagnoses. So starting with that, if you can go to slide 1, I just wanted to start out by saying in the United States at the end of 2015, there was an estimated 1.1 million individuals ages 13 and older living with HIV in the US. And also to consider the highest HIV diagnosed rates were in the southern states of the United States, which was within Florida. So if you go to slide 2, you're able to see that map of Florida and the variations in the HIV rates among the counties, with Fort Lauderdale, Miami-Dade, and Palm Beach being one of the highest among those, and including Orlando as well. In actuality, Broward had 37.9 HIV case rates, and it is actually higher among the Florida HIV case rate as well. And just to consider that, if you look at the CDC surveillance report, you will notice that the Metropolitan Statistical Area, also known as the MSA, Miami-Dade, including Fort Lauderdale and Palm Beach, is #1 in the nation when it comes to HIV rates and diagnosis. So we have the highest epidemic compared to other areas, MSAs as well. So that's very important to know, and the reason why it's so important that we discuss that here in this county of what's going on. If you move along to slide number 2, slide number 3. Earlier, as I mentioned, Broward compared to Florida has a much higher rate of HIV case rates, with 37.9 compared to 24.1 in Florida. With that, we also seen from 2016 to 2017, there was a slight decrease in HIV rates in Broward County as well. Moving along to slide 4, looking about our cases among male compared to females, majority of our cases in Broward County are in the male population. So if we move along to slide 5, before I get into the statistics among our women of color, it's important to note when we do our activities, our prevention efforts, who are we keeping in mind, what populations are we keeping in mind? And based on the statistics, Black heterosexuals are among that population when it comes to our primary HIV prevention efforts. We address that, and you can see Hispanic heterosexuals, white MSM, Hispanic MSM, and Black MSM as well. So keeping in mind Black and Hispanics being in that top 9 actually, priority populations. Moving along to slide number 6, it's important to note that 1 in every 44 Blacks are living with HIV compared to whites, which is 1 in 93 that are living in HIV. So Black population is disproportionately affected by HIV, meaning that the cases are actually higher than the actual population itself in Broward County. Blacks only account for 27% of the population, but in actuality make up among 45% of the cases in 2017. Moving along to slide number 7, I wanted to also highlight that with our Black heterosexual females, the HIV case rates are higher than males. So that's very important to note with 100 versus 64 in males. And also it's important to note with our Hispanic population, how women are affected as well. So moving along to slide number 8, you will see with compared to males and females, males have a higher rate of HIV cases, but it's important to know that females are having sex with males. So it's that's something that I wanted to highlight as well. And going into my last slide, is slide number 9. Unlike Black heterosexual females and males, the HIV cases among Hispanic heterosexual males and females are higher in the male population as well.
Wow, that's a lot to unpack. It really, really is. But I want to know from you, why? Why are the incidents of HIV infection or Black males living with HIV, why is it so high amongst Black heterosexual males in Broward?
Well, there's a number of reasons to that. With the MSM population, also known as men who have sex with men, primarily a lot of our cases are in the MSM population. That's a type of mode of transmission per se. Also, there's other factors as well. And if you want to bring up slide 10, that can kind of go into that as well, of factors affecting disparities, which is late diagnosis of HIV, access and acceptance to care, delayed prevention messages as well plays a big role. Stigma, which was mentioned earlier, something that we've been talking about for many years and continue to talk about it even 30 years later, that we're still addressing and trying to uncover here in Broward County, as well as the prevalence of HIV and non-STDs in the community. When someone has syphilis, chlamydia, gonorrhea, they're more susceptible and more at risk for HIV transmission. Also, the prevalence of injection drug use, the opioid epidemic, things of that nature plays a role as well. And lastly, the complex matrix of factors related to social economic status. So considering our social determinants of health, lack of transportation, employment, economic status, those things, housing, there's so many various issues that play a role in disparities among either Black women, men who have sex with men in our Black and Hispanic communities.
And very quickly, Simone, you mentioned that if you have an STI, someone has an STI, there is a higher susceptibility to becoming infected with HIV. Now, is that something about those other infections themselves, or is it the risky behavior?
It's risky behavior plays a role as well, but it's having a bacterial infection increases your chance of HIV, especially if you're having condomless sex as well.
Thank you. Because, we sometimes hear that and we're not sure whether it's the behavior that's the cause or it's the actual other infections themselves. So that's an important distinction. Thank you. Thank you very much. So we're going to kind of shift gears and go to the next topic. And Shalisa, I'd love to hear from you, Shalisa Hafley, who's the health educator consultant. I'd love to know from you some HIV risk factors. I think many of us know them, but it feels like we need to be reminded. So could you go through some of these risk factors, please?
Of course. So some risk factors for HIV can be blood, semen, vaginal secretions, breast milk, and mother to baby through childbirth. With blood, the risk is with sharing of needles through injection drugs and equipment as well. And when you're talking of injection drugs, it's more to it aside from illicit drug use. You may have people who's diabetic and need to use needles for insulin or for steroids or for hormone therapy, but the risk is sharing of the needle and the equipment, which carries that blood as they are sharing the equipment and the needle. And through vaginal secretions and semen is more geared towards sex with unprotected sex. expose each other to those vaginal secretions and semen from each other. And with childbirth, with breastfeeding, if a mother contracts HIV after having their baby, postpartum, and they choose to breastfeed their child, they can pass it through the child through that method as well.
Great. Wow. So is there anything new that you've noticed in terms of risk factors compared to past years? Or do we have kind of a handle on some things?
As far as anything new, the same risk factors are contributing to HIV because the most prone way HIV is transmitted is through sex. But outside of sex, you have other ways such as injection drug use and also occupational exposure to people who may work in certain fields such as the healthcare and medical field who are exposed to bodily fluids and maybe a possible needle stick or something of that nature.
Okay, wow. Well, thank you. Thank you very much. And I want to go to the room for a minute, take a break and go to the room because I did notice Tramika Wade, who's a member of the South Broward Alumnae chapter, is on Facebook Live. And she asks, what are the age ranges among Black males and Black females? And I'm guessing she means in terms of HIV infection. Or if you could give it in terms of HIV infection rates of, and then maybe those living with.
Okay, so I can touch on people living with HIV. Majority of our cases are in the older population, our 58 age up population, more so of that, 40 to 49 as well, following that, and also 30 to 39. Majority of our cases are in our older population.
Are these new infections or are these people that have been living with HIV for a while?
These are people living with HIV for a while.
Okay, okay. Wow. And in terms of but you're not quite sure about new infections. I'm wondering about the age of maybe new infections, if there is a big bloom in one particular age group or age range.
Okay, so I can talk about that. In 2017, as far as for our new HIV cases, the incidence of that, majority of along the lines of like the past 10 years, our cases have been steady. There has been a slight increase in the 20 to 29 age range.
Wow.
Mm-hmm.
Wow. Wow. Well, there's and what in terms of that, are there then messages that are targeted that, the 20 to 29 age range, those are millennials. So are there specific things that you're doing to target millennials in terms of HIV education?
Yes, definitely. Our messaging, the way we do our messaging is totally marketed to the epidemic that we're seeing as far as with the age groups. So the colors that we use will be different. The places that we're putting out these messages will be, at bus terminals and bus benches and billboards and social media. So the state health office created an entire website that's dedicated to that. And when you look at the images reflects the epidemic and where we're seeing the ages. So a lot of the images are more younger. They're in that image group that you may have a DJ, you may have someone dancing. So the way we're marketing the messages is totally based on the age populations that we see the increases in.
Wow, thank you so much. So I want to now turn back to you, Simone, and if you could cover the 4 key components. I know that's something that you all are really working with. I'd really love for you to cover those 4 key components for the audience.
Oh, yes. So I'll do a brief overview and then my colleagues will go more further into this.
Okay, wonderful. Great. Thank you.
It's also known as the Florida's plan to eliminate HIV transmission and reduce HIV-related deaths. It came out in 2016 and it was spearheaded by our state office, our Florida Health Department, which we're under. And the plan is to really just address this HIV epidemic, and these 4 key components were decided to address that. It starts with implementing routine HIV and sexually transmitted infections, screening in healthcare settings, and priority testing in non-healthcare settings. Also, it's provide rapid access to treatment and ensure retention and care. That's our test and treat component. Third is improve and promote access to antiretroviral pre-exposure prophylaxis, PrEP, and non-occupational post-exposure prophylaxis, NPEP. And lastly, it's our community mobilization, which is increased HIV awareness and community response through outreach, engagement, and messaging. And this information is also on our Florida State website as well, which can be pulled up for you guys to view for your viewing purposes.
Great, thank you. And then so Shalisa, you're going to go a little more into this, yes?
Yes.
Okay, go ahead.
Okay, so with routine testing, people living with HIV will now be diagnosed earlier. So with the early diagnosis, they will have access to treatment. And with that better access to treatment, because of that early diagnosis, they will have better health outcomes and decrease the chance of HIV being transmitted to someone else in the process. Now, with that routine testing here in Broward at the Florida Department of Health, along with Centers of Disease Control, we have reached out to about 400 physician offices, encouraging them to adapt the routine testing method in their clients' routine checkups and blood work. So with the adoption of the routine testing as part of routine blood work and checkups, clients, everyone will have opportunity to have HIV testing being offered to them at their annual checkup visit. And then along with that annual checkup and the routine testing will also reduce the stigma towards HIV testing as well.
Great, wonderful. And let me really quickly go to the room because I did see one question. Bridget Bain, who is the welcome, Bridget. She is the chair of International Awareness and Involvement, who is one of the entities putting this on today, asked if you can speak on elderly transmission.
As far as what with elderly transmission?
Bridget, if you could clarify your question, that would be great. Maybe she's talking about the rates of elderly transmission or the amount of elderly living with the disease.
Okay. I don't have that number right here with me, but we do have a large percent of people living with HIV 50 and older. So I actually believe it's around 40%, but I don't have the exact number with me right now.
Okay, wow, 40%, that's pretty high. Thank you very much. So now let's talk about this. There's this commercial that's out now and I actually know somebody who's an actor in that commercial about PrEP. It said, I take PrEP, or I use the pill, so that's something you see all the time. And I'd love for somebody, Cramita, if you could talk about PrEP, which is pre-exposure prophylaxis. Exactly what is it and what does it do? Tell us a little bit about it.
Okay, so what PrEP is a prevention option for individuals who are HIV negative and they want to reduce the risk of becoming HIV positive. It's Truvada for PrEP, which is 1 pill a day that an individual can take. They have to take the pill once a day, every day, and it will reduce the risk of contracting HIV. Truvada should always be taken with use of a condom as well. You shouldn't stop using a condom because PrEP does not prevent any other STIs. It only helps to prevent HIV. So in a nutshell, this is what PrEP is.
So, okay, so the next logical question, or maybe it's illogical, it seems to me that if they've made this much headway in terms of being able to prevent it, why is there not a vaccine?
Well, those type of things are in the making. Like this medication has been on the market for around 20 years, but it's only been approved for prevention since 2014. So
wow.
All of the testing and the routinization has to go forth with the CDC and all the FDA and things like that. So all of those things are in the process of getting approved and going through. Right now, we have this awesome tool to help reduce those numbers of new infections in the Broward County area. And we talked earlier about a disparity in our community, in the African-American community, knowing about resources. Well, with Broward County, the PrEP program is actually an awesome program because we have a navigation program with the PrEP program where we actually navigate clients who want to be on PrEP. We will get them set up, whether they have insurance or they don't have insurance. We're able to assist them with getting PrEP. So there's no barriers keeping them from getting the medication. We have the PrEP commercials that's out that is geared to all of those targeted populations. So the PrEP program with the Broward County Health Department is a really awesome thing right now, and we just need to get the word out for everybody to understand.
And how is that work? Like, are the commercials and are the ad campaigns effective in getting that word out?
Definitely. Right now, we have an active PrEP clinic that's at the Broward Wellness Center. Since the onset of June, we've enrolled around 908 people, if I'm to be exactly, that's the number. So it's doing an awesome job. And like I said, we navigate them for a full year.
Wonderful. Wow. Well, it seems like some headway is being made in that area anyway. So thank you so much. So as we wrap this up, I'm going to ask Crystal Kirkland Mobley. I love your name, by the way. It's just so theatrical. I'm going to ask Crystal to talk about community mobilization and resources that are out there on the subject.
Before I talk about community mobilization and resources, I think it's very important we go to Sonia to talk about test and treat, because we're testing people, we're giving PrEP, but we need to make sure we talk.
4 hours, the goal is to have meds in hand. An LRS, that's a linkage retention specialist, will be dispatched to the location where the client is, and they will stay with them through their appointment, make sure they have a follow-up appointment, set up their ADAP appointment, their Ryan White appointment, until that client's meds are in hand. So sometimes they're with them for 2 hours, other times they're with them all day. Out of the 1,576 clients that were referred to test and treat, 1,391 have been enrolled. That's 88% enrollment rate with the 82% viral suppression rate currently in test and treat.
Wow. Okay. Thank you. Thank you. That was very important to know. So thank you for making me go back and having you address that. So now let's talk a little bit more about community resources. Crystal?
Yes, so the knowledge and understanding of HIV prevention strategies and available resources to live healthy and critical to reducing HIV in Florida. We heard the data that Simone presented, and approximately looking at the state, 15 Floridians are diagnosed with HIV every day. That's why it's so important to have the community messaging out there, having it out there where we're sharing all of the valuable resources that we have statewide and locally as well. For additional resources on PrEP and HIV testing, where you can get free condoms at around Broward County, because we have over 1,200 businesses that we have recruited through our Business Response to AIDS initiative, where we're giving out free condoms to these businesses to give out to their patrons, and pamphlets and educational materials and everything that you will need to be linked to the Department of Health to receive the services. The information is out there. It's so important that we share that. So you can visit our getprepbroward.org website for additional resources, places to get free HIV testing, places to get free condoms, more information on the PrEP program and how you can be linked to Navigator. You can visit the state website, www.knowyourhivstatus.org, or you can visit a federal website, the hiv.gov website, for additional information on HIV testing and treatment. And also, as a resource, I want to put out there our PrEP hotline that Carmita talked about earlier, and put the number out there again. That number is 954-295-1211. And you can call that number 8 a.m. in the morning or 8 p.m. at night or 10 p.m. at night. Someone will answer that phone. And if not, you leave them a message. They'll give you a call back when they finish with the other client, and they'll navigate you to the PrEP program.
Wow, wonderful. That's great information. So speaking of the PrEP program, we have a question in the room from Bridget Bain. She asks if it's appropriate to recommend PrEP for teens.
Yes, it is. PrEP is actually been approved for teens. We do, if you go on the website, we do have some PrEP-friendly pediatricians that will be able to prescribe PrEP for those individuals. It's been approved for age 13 and above.
Oh, wow. Okay, interesting. And what is the general feeling towards that, towards having teens take PrEP? Have you heard anything, for example, from parents about that?
Well, the thing that I've noticed is that not a lot of people are aware that this is even an option for them. So once they get the information, of course, they have other questions. When it comes to the teens, we have to refer them out to an actual pediatrician who's able to go ahead and prescribe for the teenagers. Because in the wellness center where we are, we don't treat teenagers. So we really don't have that everyday conversation. But going into the schools, they are welcoming to the information, and really, really glad that they have this avenue that they can possibly take.
Great. Also, one other question from Shakita Antoine, who is also a member of the South Broward Alumni chapter. She asks, would you say there is a larger percentage of patients infected with HIV that are uninsured?
Absolutely. Absolutely. About 89% of the test and treat clients are uninsured.
89%?
Yes.
Wow. Wow, that's like, and now I guess that's in keeping with the numbers of uninsured in general. So,
Right.
Wow, mind blowing, and something needs to change clearly. But it's great that there are resources that you have out there that you are able to help individuals who need help and give information to individuals who need the information. So, before we wrap up, two things. For those of you that are wonderful members of the South Broward Alumni chapter of Delta Sigma Theta Sorority Incorporated, guess what? This counts as an event for you. So yes, if you're a member of SBAC, you have attended an event tonight, but you have to prove that you've attended it. It's a Christmas party, and not this Friday night. It is December. Put the date in the chat for me, and I'll put it after. So there's a Christmas party, 500 plus guests, 9 p.m. to 1 p.m. Festive holiday excitement, hors d'oeuvres, cash beverages, vendors, DJ, and we're also collecting gifts for Broward homeless youth. That is going to be at the Bahia Mar Hotel, which is a great hotel on Fort Lauderdale Beach. Also, Saturday night, the following night, is the Boat Parade Yacht Party. And if you know, the Boat Parade is a big deal here in Fort Lauderdale. That's a party that's going to include 400 guests on a beautifully lit vessel that on the Intracoastal. So you guys really, really need to come. That's going to be from 6 p.m. to 10 p.m. 9 p.m. to 1 a.m. is the party the night before, then 6 p.m. to 10 p.m. And by the way, the Bahia Mar is the host hotel for this, so you can come and make a whole weekend of it. You don't have to live in Florida. We also have a car raffle drawing. So and you can win some nice stuff. So you definitely want to do that. For more information, you can come to our website, dstsouthbroward.org, for more information. And let me take a look at the chat and see if they put the information. Thank you. Darmichelle Moore says it is December 14th and 15th, right? So the party is the 14th and the boat parade is the 15th. Or is it the 13th and 14th? Please clarify for me, because I don't have the calendar in front of me. But whatever the Friday is, which I believe is the 14th, is the party. The Saturday is the 15th. That is the boat parade. Tickets are still available. Go to dstsouthbroward.org for more information, and it's right at the top. All right. So you could take the video away, Curtis. All right, thank you. All right, ladies, every year it is such a pleasure. This is the third year we've done this with you, and each year it just gets better and better. You are such a joy and a pleasure to be with. I feel like I'm having a conversation with some friends. So this was great. Thank you so much for all of the information. And can you one more time give a website and a number where people can contact you for information?
Yes, www.getprepbroward.org or .com, or you can give us a call at 954-295-1211.
And do you have any social handles like Twitter, et cetera, that they can reach you on?
For the state Florida Department of Health, and you can find us on Twitter, Facebook, and Instagram under Florida Department of Health.
All right. So see, they're up with the times too. They are on the gram. So with that, let's go. Let me go through again and thank all of you on the Facebook Live side and on the YouTube side for watching this important conversation. Also, thank you to Bridget Bain and the entire International Awareness and Involvement Committee. Also, the entire chapter, South Broward Alumni chapter of Delta Sigma Theta, for watching. Also, the person running the bells and the whistles behind all of this, that's Curtis Brooks from Curtis Brooks Media Production. Curtis, you always do a smash up, bang up job. So thank you for your help with this program. Also, let's say thank you to the UNA USA Broward County, the United Nations Association of Broward County chapter, and Dr. Eileen Davis Jerome for her support of this program. And I think I have sufficiently thanked everyone, but let me say again, thank you to all of you for watching. We will continue to be active in the digital space. You'll continue to see us on YouTube and Facebook Live and maybe a few other platforms in the future as well. So with that, I want to say thank you, God bless, and we hope to see you at the Winterfest Boat Parade, our boat parade, also the party, and on the next live stream. Cheers. Good night.
Good night.
Good night.